Now we're going to hear from Jonathan Bacon, the Intervention Developer Coordinator at RÉZO. He works on the unceded native territory now called Montreal. His experiences and interactions with sex work, substance use, mental health issues, and trans rights all inform his development work. Welcome, Jonathan.
Good morning, everyone. Thanks for joining us this early on a rainy day. I'm going to jump right in. So first of all, RÉZO's work, and thus my own, happens fully on the unceded territory of the Kanien'kehá:ka. This land was also a meeting place for other nations, including the Anishinaabe. And Tiohtià:ke, or what we now know as Montreal, was never surrendered or ceded by the Kanien'kehá:ka. So we know systems of colonization were used to fraudulently exploit and acquire this land and its resources, and much privilege and opportunities afforded to people living in Montreal today are directly derived from that ongoing injustice. And it is my job over the next 5 years to ensure that my work directly contributes to undoing these systems of colonization, and I'm constantly learning how to do that. And this really writes itself well in my 5-year plan, which follows an excessively simple structure. First of all, I want to get knowledgeable. This means learning to look at my blind spots, and this is where learning to decolonize my work happens. Then I want to establish priorities and partnerships, ongoing partnerships. Afterwards, I want to develop interventions and programs based on that knowledge and those partnerships, and then I want to evaluate what I've done, and start, rinse and repeat all over again forever, which is great. Montreal was pretty lucky in that in 2017 we had the MOBILISE study. MOBILISE got us a lot of data to start off with in my formative research, and I'm thankful that Joanne Otis, the lead researcher, allowed me to use some of her qualitative data for my presentation today. I first looked at the barriers to access to PrEP and to services. So when it came to services, shame was definitely the biggest issue in accessing services. Either shame in having to use services at all, or shame at needing to disclose intimate details to health personnel. When it came to PrEP, the biggest issues were worries about its efficacy and worries about potential side effects. But my favorite part of that data is what concerns community. In MOBILISE, men generally reported not having a great sense of belonging to the LGBTQ community in Montreal, and they also reported that that sense of belonging wasn't really important to them to begin with. And that has definitely underpinned my work so far, in the sense that we are a community organization, and well, how do we do community work with a community that doesn't see itself as one? And I don't have the answer yet. So I also look at RÉZO's own strategic planning, which happened in 2017. The planning included both internal discussions and external components, both online and in person. Community came up again in that planning, specifically in the question of how do we navigate modern gay socialization. Other priorities that emerged including fostering culturally competent healthcare and intersecting mental health, substance use, and sexual health, specifically in the age of PrEP and U=U. Finally, in May, I held my first community consultation. That consultation wanted to assess people's needs, specifically regarding a Francophone Queer Men's Health Summit that we're supposed to organize starting this winter. So if that's something that you maybe want to participate in, you can go like our Facebook page. It's called RÉZO, simply. You're welcome. That community consultation specifically highlighted mental health as a priority. Again, looking at destigmatizing mental health and creating resources for mental health. It also included creating more space for trans folks in our programming. It included reaching people who don't feel concerned by our work but maybe should. And it included educating cis queer communities on trans issues. Another part of this formative research was an online inquiry into the needs of bisexual men that I ran in June and July of 2018. My favorite question was my wish list question. So I asked, if you could have any service from anyone right now, what would it be? And over 50% named a desire for mental health consultations with either a psychologist or a sexologist. When I asked them what they thought their biggest health issue was, 44% named mental health issues, more often connected to depression, anxiety, or self-esteem. And my question about what could RÉZO do for you, or what should RÉZO do for you, 25% asked specifically for psychosocial support, and 42% wanted us to help destigmatize bisexuality, not only within the population at large, but also within other queer communities. So this notion of education within our communities comes up yet again. And I mean, I'm just going to take a wild guess here, but I think that might be connected to people's sense of community, right? So looking at all that, 4 priorities emerged for my work. First of all, promoting and creating access to mental health services, then developing and or increasing peer support, fostering culturally competent healthcare, and increasing knowledge about and access to PrEP. To start answering these priorities, thank you. The first thing I looked at was developing a project called RÉZO-RAMHS, which stands for Rapid Access to Mental Health Services. This is a provisional title because I'm not good at naming what I create. But the program seeks to facilitate access to mental health services by developing partnerships with local mental health professionals and practicum students. It was developed with a lot of help from HIM's mental health program manager, Aaron Purdy. So I don't know if you're here, but thank you, Aaron. The rates are dependent on the participant's income, ranging from $0 to $60 after an assessment by RÉZO staff. And if all goes well, I'll be launching this in early 2019, if all goes well. This graph here hopefully can help you understand a bit more how it's going to work, and I'd like to draw your attention to that third option there, which is the bulk of our program. So within this program, RÉZO provides free working space for professionals to receive clients in. In exchange, professionals agree to receive RÉZO's referrals at a fixed predetermined rate. RÉZO and the client then share the burden of the rate, and the ratio of that sharing depends on the client's yearly income. Should the client's needs or income not fit within that program, we could offer them in-house counseling services, which are already offered for free by a team of over 10 workers. We could refer them to practicum students for a cheaper rate, and that I'm currently working on. Or we could refer them externally to specialists we trust, but aren't a part of our main program necessarily. The expected benefits for this program, I mean, apart from the obvious of increasing access to mental health services, we hope the program can really clearly set us on course to being recognized as a global health agency. So let's hope that happens. Other little things I'm working on, but I can't get into much detail about because time is a thing, include a peer support program. So we were really inspired by Prepsters and how Prepsters showcases real people's stories and lives in accessing PrEP, meaning that PrEP becomes a peer-relatable and approachable topic to talk about. And we sort of want to make that we apply that model to global health in general. So we want to recruit peers with lived experience in several fields, ranging from substance use to mental health to trans experience, and make them available as sources of information that aren't tagged as outreach or social worker, because we know that simply accessing a service is a barrier in itself. The program will have a face-to-face and an online component, and I want my peers to have creative capacity, meaning that they should have the resources and the freedom to develop events and tools that they deem appropriate. I'm also repurposing Engage's Community Engagement Committee to make it into a semi-permanent, paid and supported committee for all of RÉZO's projects, research opportunities, and programs. I am developing a partnership with a local detention center that I can export afterwards, a program in which we'll first of all offer HIV and Hep C prevention workshops and offer one-on-one support with inmates that we already know. And there's a specific synergy here with our sex work program, where I worked for a few years, because incarceration usually meant we lost contact with our people, and now, well, we have a great excuse to go visit them. On the workshop development side, I developed a workshop called How to Intervene with People Who Practice BDSM with my colleague Gabriel Beauregard. The training basically seeks to demystify some aspects of BDSM play and provide common approaches to intervention. And my hope is that the training can allow clients to be more open about their practices and professionals as well to be more receptive and knowledgeable. I'm also putting together a workshop for health institutions in our area in collaboration with the MOBILISE team. The training will allow institutions to follow up on how they were evaluated by the MOBILISE survey in 2017, hopefully using that knowledge to make their services more accessible and appropriate for our people. So as a last little point, I'd like to acknowledge some limitations of my work so far. So far my work has been very Montreal-centric. Hiring a coordinator in Quebec City was the first step. Hi, Patrick. And collaborating with provincial COCSIDA has to be necessary other steps. Wow, I'm doing great on time. My work so far is also very settler-centric, and it'll be my responsibility in the next few years to ensure that I'm collaborating with Two-Spirit and Native individuals and organizations to make sure that not only my future programs are appropriate and pertinent, but also that my current programming can be adapted to suit their needs as much as possible. Here's how to get in touch with me if you have any questions, and I'll also be taking questions in French and English at the end. Thank you.